hospitals. I'm crossing back over to CNN News 18's Nikhil Lakwani, who's joining us live from Felix Hospital in Noida. Now, Nikhil, one thing I did want to ask you about this is that the first step is for the government to check the COVID preparedness of these hospitals. The next step is to really move forward and understand where improvements need to be made. Will any of this information be given to the public by any chance?
Well, Aisha, this becomes an important question given the laxity in the place. If you remember, if you go by the figures as well, since last next couple of months, previous couple of months, so to say, many of the numbers so far were in the declining position. But now, since last week, as far as the official figures are concerned, there has been an increase of 11% active case loads in the entire country. So the laxity is where we need to be on the alert mode. And as mentioned earlier as well, since the celebrations around the corner, the Christmas has already left. We are seeing that people are approaching towards the tourist places as well. They are thronging the markets, they are thronging the places as well. This is the reason why it becomes crucial that we have to be on the alert mode, but at the same time there is no situation of panic. But we have to make sure that the basics which were directed to us during the first lockdown, during the initiation of the COVID pandemic into place, only those basics needs to be experienced and observed by all the people across the country. So this is which is also a part of the mock drill. But talking about the mock drill, we are going to check the healthcare facility, the operational readiness of the healthcare system, the staff as well, nurses as well, doctors as well, how much are they prepared, how much are they in number, the vehicles as well, ambulances as well, different vehicles as well, which are used as a part of the exercise. Also, at the same time, they are going to check the drug store as to how much is the stock left of the overall medicines which are used during the recuperation of the COVID disease. Although there is not special medicine as such, but the basics which were directed to us during the start of the pandemic. Also, the checking of the ventilator, oximeter. Oxygen is also one such crucial thing which needs to be checked. The functioning of the same, the pipes are working properly or not. Are there adequate supply of oxygen to a particular plant, to a particular hospital or not? These are some of the lists that needs to be checked today as a part of the nationwide mock drill, and it needs to be conducted in the entire country. Yes, to reiterate again, the health minister has also said that there is no situation of panic as such. This is also one such reason why there is not official guideline that has been issued so far by the Union Health Ministry. But if we talk about the overall cases, it is currently over 3,000. But yes, there has been an increase of 11%. But if we talk about vaccination number as well, Aisha, it has crossed 220 crore figure. So this is also one such great thing. But the booster doses, if you remember, since last couple of months, since we were observing the laxity, this is the reason why the people were not interested in getting themselves inoculated with the additional dose, that is the booster dose. But now the new alert is concerned, 97,000 people, over 97,000 people have been inoculated with the booster dose in last 24 hours. This is one such important thing. So these are some of the measures which needs to be taken as a part of the country being in the alert mode. Already the guidelines have been issued. But amid all these details, Aisha, Karnataka has become first state to issue the guidelines that at the public places, including at the cinema halls, they have to wear the mask. The wearing of the mask has become compulsory, but there is no official fine on the same. But yes, Karnataka has become the first state. But also, if we talk about the national capital Delhi, at about 12 p.m. we have been told that the largest facility of the Delhi government, that is the LNJP hospital, at that particular hospital as well, the minister in the cabinet of Arvind Kejriwal, Mr. Manish Sisodia, who also happens to be the Deputy Chief Minister of the National Capital, he is going to be present when the mock drill is going to be conducted in the LNJP hospital. So not just in Noida, from where I am currently reporting from, in Delhi, in Gurugram, not just in the entire NCR, but in the entire country, this is the nationwide mock drill which needs to be checked to check the operational readiness of the healthcare system. Back to you, Aisha.
Absolutely. Nikhil, thank you so much for providing us with all of those details and for giving